Welcome, everybody. Ziegler. I'm with Provider Outreach and Education. Today, I'm joined by Francine. He's supporting me as my co-host, so I want to thank him for his assistance. I'm also joined by the newest member of our PO team, and that's Shakura Harris. Thanks for being here today. The purpose of today's webinar, as you can see here, is to learn about correcting claims in direct data entry or DDE. It's part of a series that we're doing that's focusing on navigating and using direct data entry, which is part of the Fiscal Intermediary Standard System. We have other courses that we've done with background information, how to get started and signed up with DDE. Another one on how to move around in the system, that navigation, checking eligibility for your patients, and exploring some of the different inquiry menus. And if you weren't able to join us live for any of those events, they are all available as an encore. So if you want to watch it, rewatch it, or share the information with someone else, you can make sure that that's available. And we made that available for everyone who is interested in finding out more about direct data entry. Our time together includes reviewing some basic navigation principles within DDE, including defining some terms, drivers, status, location. We'll discuss the importance of checking on your claims to watch them progress through the system. We want them to go as quickly as possible with the least amount of intervention. Along the way, I'm going to share some tips that'll hopefully help you learn more about DDE, what it can do, you can use it, how it can benefit you. As we begin to talk about navigation in DDE, we also need to have an understanding of how claims themselves move through the system. What's the logic behind it? Is there any? Sometimes it may not seem like it. What determines the path or the outcome of a claim once you submit it? Our navigation as users is done by way of the menus and submenus. Various keyboard commands help us maneuver around. The path a claim takes is influenced by the other things that you see here, those drivers, status, and location, and more. We're going to define each of these to help us all have a better idea of how all of this plays a part in correcting a claim. Now, the main menu is where it all starts. This is our jumping off spot to everywhere else in direct data entry. You can see the different menu options here: inquiries, claims/attachments, claims corrections, and online reports. To select the claims correction menu, we're going to enter a 3 or a 03 in the lower left corner and press enter. If you've watched any of our other videos, any of our other sessions that we held, you know that the 0 is not actually needed. I just typed it as it's shown to make it easier for those of you that might be seeing this for the first time. So you'd use your tab key and you'd put your selection right here and press enter. So here is the claims correction submenu. On it, we can see the different sections for corrections, adjustments, cancels, and attachments. So this is just a kind of a preliminary sneak peek. We're going to go back and look at this in just a few minutes. That I want to define for you is driver. There's drivers for cars, there's drivers we use in golf, but in DDE, the driver determines the sequence of processing of a claim. This is hard coded in the system. It can't be modified. And because of this coding, it's pre-established by type of bill. So think of it as a roadmap or GPS, if you will, for each claim with a certain type of bill. As an example, every 131 outpatient hospital claim will get on the freeway in the same place. It's going to get on the interstate in the same place. It's going to stay in the same lane, and it's going to take the same exits until it reaches its destination, which is, of course, hopefully on your remittance advice in a paid status. When I was first learning about direct data entry over 20 years ago, drivers were a hard concept for me to grasp. My explanation is to imagine the claim at the beginning of a long hallway with a lot of different doors. The remittance advice is at the end of the hallway. Remember, that's our destination. That's where we want it to go. And then each door is a room along this hallway that your claim has to pass through before it can continue to the next one. Each room is a different driver that checks your claim for different things. Each time that claim is updated, meaning it's changed, corrected, and stored, your claim is going to go back to the beginning of that hallway and stop in each room or driver again. The exception is medical policy or medical review. It's only going to go through that room or that driver once. So I hope that kind of elementary explanation will give you a better understanding, help you visualize the concept, to make sense of why your claim may hit an edit. You fix it only to have it kick out for something else the next day. Like, why couldn't it just give you all of the reason codes at once so that you could fix everything? It seems like it would be more efficient. But the reason is that once your claim hits an edit within a driver, it can't go any further. So it hasn't gotten to the next room or the next driver for those subsequent reason codes yet. Hope that makes sense. The next item that we need to define is status. As billing transactions process, they move through various stages of the system. These stages are identified by status location codes, and that provides information about what's happening with a claim. Sometimes the status location indicates that you need to take action on a claim in order for it to continue processing. There are 6 main status codes that are represented by one letter, and you see them listed here. By looking at the status, you can quickly find out what's happening with your claim. So we have T as in Tom, which stands for returned. I stands for inactive. R stands for rejected. D stands for denied. And I'll pause here for just a second, because if a claim's rejected, it's not being paid. If an item or service is rejected, you're not getting payment for it. The same with denied. You're not receiving payment from Medicare, but the reason behind why you're not getting payment and the steps you need to take after that are a little bit different. Something that's rejected is either a user error, a billing error, something system related. Something that's denied is calling into question something about medical necessity. It may have been reviewed by a person. Your claim may have been compared to a local or national coverage determination. So rejected is something that is more technical in nature. Something that is denied is more coverage criteria or medical necessity. So they are different. Moving on, S means suspense, and P means paid or processed. I like to use processed more than paid because you can have a claim with P status that still has lines that are denied or rejected. So if you have a claim that's in P status, hopefully every line of the claim is paid, but not necessarily. Location. Locations are 5 characters that follow the status code. Locations further define what's happening to a claim in a particular status. So it routes the claim through this by telling the system to forward it to a specific site before any other activity occurs. DDE prioritizes where a claim resides within an internal ranking table. So there's a hierarchy involved. And that happens when multiple reason codes and therefore multiple status are received. So the system is going to rank those or prioritize those to point the claim to a specific status location. Now we'll define reason code. If you attended any of our previous webinars on this subject, we talked about reason codes and their role in direct data entry. But for those of you who might be hearing this information for the first time, reason codes are used by DDE to direct the outcome of an edit or process within the system. Each reason code points to a specific status and location code. The assignment of a reason code overrides the normal processing sequence of the claim path. So it's a detour, if you will, as it travels down that make-believe freeway that we talked about, or that hallway, that metaphor that I gave you. Multiple reason codes or edits can be assigned to any claim depending on the situation. And actually up to 10 can appear on a claim at once. I personally don't think I've ever seen one with that many, but for those of you that have worked with FIS and worked in DDE for a while, you know that it's not uncommon for 1, 2, 3, 4 reason codes to be on a claim. Now, fixing one may take care of multiple, and at the same point, fixing one may cause another one to appear. So it's a process. So on slide 8, back a few slides ago, we reviewed some common status codes. Now this slide outlines the different locations, and we're going to be using this table as we go over some examples here. So I don't expect you to memorize this table or know all of this information by heart, excuse me. Medicare is not like that. Medicare is not about knowing everything there is to know, because things change. It's more about knowing where to go to refer back. So that's why we always like to give you a lot of references and resources in our courses. So I want to pause here for just a second and let's do a little status location exercise just to kind of reinforce this concept and our learning. The first example is SB 6000, or I say SB 6000. The status is the first character. So S, let's go back here just a second, see if I can't get us lost in our PowerPoint. S stands for suspense. So we see it listed here. S is suspense. And then we go to that table that we were looking at, and we can see that B stands for batch. That's over here in the processing type, batch. 60 is ADR. And if you're not familiar, that stands for Additional Documentation Request. And then 00 means batch process. So SB 6000, a claim in that status location is in suspense with an ADR. So it's pending for medical review. The next example that we have is PB 9996. P stands for paid or processed, remember. B stands for batch. 99 is, if we look down here, session term, and that's short for terminated. And 96 means payment floor. So in this case, this claim is a finalized claim, so no further action can be taken on it. So its session is terminated, and it's waiting to be released to remittance advice from the payment floor. And then the payment will be made. So that claim is done processing, but payment hasn't been released yet. What do we have next here? SB 0100. So we said S stands for suspense. Then we have B for batch. Um, 01 is status location. And then 00 is batch process. So basically what this status location means is that this claim is in between, or it's processing. So in other words, it's on its way down the hallway, but it hasn't gone to the next room yet. Once an update's done or a claim is what we call worked or stored, you may see this status location until the overnight cycle is run and it moves to the next status location. So I'm just trying to show you a variety of examples here. The next one is SMHOLD. Once again, we have the S, that means suspense. We've established that. The M, this time, this is the first time we're seeing this one, that means manual. And then HOLD, those, as you can see here, are user defined. So I can tell you that this is a status location that WPS has created, and it's the 14-day hold for each quarterly release, which is mandated by CMS. So WPS, somebody here, manually moves the affected claims to that status location before releasing them to continue processing. One last one to take a look at, and the reason that we are discussing this today is TB 9997. So T means returned or RTP'd. And then B is batch. We've had that one before already. And then 99 means the session is terminated. And 97 means final online. So in a nutshell, this claim has stopped processing. It's either pulled over to the side of the road or our highway that we were talking about, and it's not going anywhere until some necessary action is taken on it, and it's taken by you, the provider. So that is the status and location for RTP, return to provider claims. So we talked about status codes. Now we're going to talk about the status of claims. We recommend that you check your claims at least once a week, preferably daily, but that depends on the volume of Medicare beneficiaries and the volume of claims that you transmit and have in the system. on any given day. If you're a registered user of our provider portal known as SNAP, Secure Net Access Portal, you can get claim status there, or even by using our interactive voice response phone link. But in DDE, which is what we're talking about today, you can do that through the use of the claims summary, which is inquiries, main menu, submenu 12, or your claim count summary, which is submenu 56. For some billing transactions, you may need to take additional action after you've submitted the claim, and there might be deadlines associated with these actions. For example, an ADR. Again, that means additional documentation requests. We're waiting for documentation to review your claim. Some claims are returned to provider due to missing, incorrect, or incomplete information. So the sooner you realize that there's an issue by checking your claims, the sooner you can get it updated and sent on its way. Our goal is to keep our claims moving all the way to the remittance advice. So let's take a look at these actions to help check the status of your claims in DDE. The 12 up here in the title is the submenu that I mentioned. That's the number of it. They all have numbers or names associated with them. So you can check status by going to the claims summary inquiry screen. To get there, you're going to select 01 inquiries, from the main menu, and then claims summary, which is again submenu 12. This screen displays all pending and processed claims. You can view the entire list of claims, or you can search by Medicare number, status location, type of bill, or claims for a certain time period by using the from and through dates. So it's really whatever your preference is and what works for you. Once you're there and you're on the list, you can sort. Like I said, you can sort by a number of different things. And I've circled a few of them here just to show you some of the options and where they are. Medicare number, specific NPIs, if you're associated with more than one, you can narrow it down by status location or even type of bill. To view any particular claim, you're going to use your tab key. You're going to go to the SEL field right here. SEL stands for select. You'll place an S there, and then you'll press enter. So what you can do then is look at the claim. You can go page by page if you need to by using your F8 key. You can make any updates. Excuse me, you cannot make any updates here because this is inquiry only. Sorry, I just had a clap of thunder and it made me jump. From anywhere on the page, you can press F1 if it has a reason code, and F1 is considered our help key. And that's going to give you a chance to view a description of any of the reason codes that your claim might have. You can also jump to that same screen by placing a 17 or 17 in the screen control field and pressing enter. I actually have an example of what that looks like here on the next slide. So the next step in checking claim status is to figure out why the claim is pending. What does it need in order to get it to continue processing? I know this particular screenshot is a paid claim, and we know that because the status location here starts with a P, but a little bit limited in my screenshots that I have since I'm not a provider and I'm not a DDE user. I'm just using this as an example, or for instance, if you will. So from here, you can use the F1 key or that shortcut SC field that I have circled at the top there. I like to call that the shortcut field because I feel like it better represents what it actually does up here in the top left corner. Like I said, I have it circled for you. When I worked in the claims department, and I did that when I first started my career in Medicare, when I discovered this field here, it made such a difference to me. I didn't know what it was. I still don't know what every single field in DDE is used for because we don't use all of them. But what you can do is, because like I said, every sub-menu in our inquiries selection has a number or a code associated with it. And the code for the reason code menu or sub-menu, excuse me, is 17. So I can enter a 17 in that shortcut field and press enter and go to the same exact screen. Reason codes are one thing because you can use F1, look at the narrative, and then press F3 to return to your claim. But some of the other submenus might be a little bit more difficult, like just as an example, the revenue code file, which is 13. Or if you need to look up and verify an ICD-10 code on submenu 1B. Instead of backing out of the claim you're looking at, out of claim summary, back to the menu, choosing the file you need, looking at the information, backing out, going back to claim summary, finding your claim, opening your claim, going back to the page you were viewing, you just pop your cursor up there in the shortcut field, type 13 for revenue codes or 1B for ICD-10 codes, press enter, boom, you get your information, you hit F3, and you're right back in the claim where you were. I get a little excited about sharing tips like that with you because it made such a difference when I was doing my job, and I hope it can help you as well. So this is an example down here at the bottom. It's just a little snippet there, a little screenshot of what the the reason code file looks like. It gives a description of the code. So here's the code. Here's the description down here. Some are a lot longer than others. Some actually go on multiple pages. But that description is, we call that the narrative. It'll give you possible steps for resolution. If it's this, do that. If it's this, check here. Those kinds of things. There are a lot of reason codes in DDE, probably hundreds, if not thousands. And every single reason code is set to a particular status or status and location. You can also see if it's applied at the claim level or the line level. This example, 31201, you see that reason code listed here. It indicates that there's an error with the date for the first occurrence code. You can see that it's set to RTP by the T status. And then we can also see that it is applied at the claim level, C for claim, L for line. So a lot of good information on this particular screen. You look at it, then you can F3, be back in your claim, go out to your occurrence codes, take a look at that. Maybe you transpose some dates. Maybe the claim is close to the beginning of the year and you're kind of not in the habit of typing that new year yet. And you can easily correct it, store it, send that claim on its way. Another part of checking claim status is going to be investigating lines on a claim that might show as non-covered and you're not sure why. When you're in a claim, go to page 2 because that's the page where the charges are. And you can look at a detail of each line by pressing F2 or F11 twice. You can scroll through the lines until you get to the one that you need, the one that had non-covered charges, or you can input the line number here and jump right to that particular line of revenue if you made a note of which line it was on page 2. And then line item reason codes are going to show here down in the corner. Then you could go up to the shortcut field and jump to 17, which is our reason code file, and view the narrative. This page is also where you're going to find the tape to tape field. And I know that's a different term, and if you haven't heard it before, it seems kind of odd. But that's going to be on processed claims to know whether or not the claim posted to common working file. We're going to talk a little bit more about that in a little bit, but since we were on this page, I just wanted to bring it to your attention. So that's just some tips for checking status with your claims claims summary sub menu. Another option for you is claim count summary, which is submenu 56. That lets you see a total claim count and total dollar amount by status location. So this is kind of a snapshot of your claims. And it's in addition to checking the status of your claims, it could help you track cash flow and identify possible problem situations. So if you're responsible for any of those things, maybe you oversee billers or you're responsible for tracking cash flow, this screen could be helpful for you. So hopefully you'll use it here. Excuse me. You can use this screen to automatically see how many claims you have in a different status location on any given day. In the category column, which is right here, CAT for category, I just want to define a couple things here. Right below that, GT stands for grand total. So grand total for this pretend provider, they have 466 claims listed. So grand total claim count 466. Then it shows a breakdown of where those 466 claims are. TC right here means total count or total claims in a particular status location. And then it breaks it down by bill type. So 1-1 is a 1-1X, so inpatient hospital. 1-3 is a 1-3X, outpatient hospital. Here we have a 1-4X, those non-patient laboratory, diagnostic laboratory services. Here's a 1-2. A 1-2X is inpatient, but Part B only. If this was a skilled nursing facility provider, we would see 2-1s, 2-2s, 2-3s. If it was a critical access hospital, we might see some 8-5s for their outpatient hospitals. So it gives the first 2 digits of a particular bill type. I circled SB 9099 just because it has a variety, but we're talking about correcting claims. So let's pretend that this is actually TB 9997. There are 95 total claims in that status location for this NPI. Of them, 36 of them are inpatient hospital or 1-1X claims. 4 of them are 1-3X or outpatient, and 55 are 1-4X or laboratory claims. So just using this as an example so you can see a variety. So if you see a jump in one status location or all of a sudden and you're not sure why, you can then go to the claim summary menu, which is what we just talked about, and then you can filter that list by that status location and bill type to see what's going on with those claims. Are they pending for the same or a similar reason code? Could it be a potential system problem? Was there a similar billing error made, like a code or an item that was left off the back claims that were sent? And so you can use it as either a corrective action or a teaching moment for your billers or something like that. But it gives you just a snapshot, and then you can dig a little deeper if you need to. So now let's talk about corrections, claims corrections. We can't fix a claim if we don't know what's wrong with it or why it's editing a certain way, let's say. So I hope that background information was helpful for you, like how the claims navigate through the system, why they go to a particular status location, why claims are editing the way they do. I hope that puts some of those pieces together for you. Now, this slide lists the types of actions that the claims corrections menu will allow you to do. You can correct claims that are in returned that location TB 9997. You can adjust a paid or rejected claim. So claims that are in status P or R, do that debit credit adjustment there. Or under certain circumstances, you can cancel a paid claim. Now, this slide shows you just the steps to take to correct a claim. You'll navigate to 03 Claims Correction from that DDE main menu, and then you'll select the submenu based on your facility type and the type of claim. So 21 for inpatient, 23 for outpatient, and 25 for skilled nursing facilities. This is going to give you then a list of claims to choose from. And then from there, you can sort to narrow your results. You'll select the claim you want to update, view the reason code narrative if you don't already know what it's trying to tell you, make the change on the claim that's needed, and then submit the change to update the claim by pressing F9. Earlier, we saw this main menu as kind of a sneak peek here. And then, as we said, for corrections, we need to go to 3 or 03 and press enter. Then we see all our options based on the types of claims we're updating. Type the selection in the lower second here and press enter. That's going to take you to a list of claims. It looks very much like the claim summary inquiry that we looked at earlier. And the main difference is that before we could just look at it, inquiry only, but here we can actually make changes to the claims. Another difference is that this one is only going to show you claims in status TB 9997, because those are the only ones that you have access to correct here. As before, you can page through, you can sort, however you want to do that. If you're a hospital, you might want to focus on your inpatient stays first. So you might filter it by type of bill 11 first, whatever the case may be, however you want to do that. To choose a claim, you're going to follow the same process. You're going to tab to the space in front of the claim in that SEL select field, S, and then press enter. Now the claim is going to be open for editing. You're going to view any reason code narratives, make corrections based on the instructions, and then you'll F9 to store that claim and save your changes. You can then go to the next one and send those claims on their way. Once you hit F9, that is going to propel that claim from the return to provider status, and then you'll probably see it in that SB0100 that we looked at in our exercise that we did as it's continuing on its journey. If you're going to add or delete a line of revenue on page 2, there are some special processes to follow. We will be talking about them a little bit later, but I do want to tell you in the DDE manual, there are instructions on or about, I believe it's page 140 and 141. I looked at that this morning just to kind of refamiliarize myself with that. And so right around there. The exact page numbers may be different based on when you hear this message or watch the video. The current version as of the date of this webinar is June of 2025. That was the last time it was updated. Now, at times, you might need to adjust a claim after it's fully processed to make changes. So we're talking about finalized claims. And the steps to adjust a claim can be made in a very similar fashion. Adjustments can be made to paid or rejected claims, but not in all instances. Medicare has exceptions, and so we want to talk about some of those. The steps in making an adjustment also start with main menu 3, corrections, but this time you're going to have a different submenu selections to choose from. Again, you can sort the list, but if you're doing an adjustment, you know which claim you're looking for, which one you need to make a change to, and so you can simply enter Medicare beneficiary identifier, that Medicare ID, and the dates of service to bring that claim right to the top of the list. Then you'll place an S in front of the claim to select it, make the necessary changes, and give details as to what the adjustment is for. And this is done with a claim change reason code and adjustment reason code. Once you've done all those things, you submit the adjustment by pressing F9. So those are the steps that you're going to take. Now let's look at that. So with adjustments, you're going to be utilizing these options highlighted here when you go into 03 claim correction, and then you go into adjustments. So these are going to be your choices here. Then you're going to make your selection down at the bottom and press enter. Now, once you get here, a couple things to note. The status location is going to default to a P. P means paid or processed. So if you need to make changes to a rejected claim, tab to that field, change it to R, and press enter. Same process. You're going to select the claim and press enter. If the claim that you need to adjust is in status location PO 9998, the letter O, let me see if I can get this right here. The letter O means that the claim is offline. So due to its age or the number of claims in history, it's been archived. Now in this instance, what you need to do is place an S in front of the claim. And then what you're going to do is press enter. You'll notice when the claim opens that all the fields are going to be blank. So if you didn't notice the status location, when you see that all the fields are blank, that's going to be your clue that this claim is offline. And then from there, you press F10. There's going to be a system generated message that states your claim will be available in 7 days. But another tip for you, depending on when you request it, it could be much less than 7 days. So I don't want you to wait a full 7 days if you don't need to. What needs to happen is that the system needs to run a weekend cycle for it to be retrieved. So the claim's going to be available the following Monday. So if you request the retrieval on a Tuesday, let's say, it's going to be almost 7 days before it's available. But if you request it on a Friday, it's still going to be available that next Monday. And you won't find that information per se in the DDE manual. So I wanted to bring it to your attention. So it has to run a weekend cycle for it to be retrieved. So then the claim will be available, like I said, that following Monday. Once the system brings it back, then you can proceed with your adjustment. There is information about this process, the retrieval process, in the DDE manual on pages 150 to 152. So after you have selected the claim for adjustment, you notice that the type of bill is automatically going to end in a 7. That indicates that it's an adjustment. You're always going to need to choose the appropriate change claim reason code. And that's going to reflect why the claim's being adjusted. In this example, D1 reflects a change in charges and is placed in the condition code field. The valid codes that you can use are listed in the manual on pages 149 and 150. Again, that's in the current version of the DDE manual. You're also going to need to add what we call an adjustment reason code. And this is placed on page 3 of the claim. And I've highlighted that area here because if you haven't done an adjustment before, you may not have noticed that field. What is the adjustment reason code? The adjustment reason code is a 2-digit code, and it identifies the reason for performing an adjustment. The adjustment reason code supplements the claim change reason code. So it gives the system more detailed information. I have an example here, and it's pretty common. A D1 condition code is used to request a change in charges. An example is an SA. That adjustment reason code indicates that it's an increase in the covered charges, whereas an SB indicates a decrease. So it's just getting a little bit more detailed for the system and essentially for CMS as to why that claim that's already processed is being changed. When you go to the adjustment reason code screen, which is submenu or shortcut 16, initially it's blank. So when you go there, don't panic. You didn't do anything wrong. If you want to look at the list because you're not sure which one you need, press enter again and then scroll through that list using your F6 key. That's going to scroll forward for you. You could also type in a code, and I should have highlighted this for you, and I didn't, but you can put it right here. If you're just trying to verify, you think it's SA, but you're not sure, or was it SB, you can type in a code and then it will sort it and give you a definition of that particular single code. Remarks. Remarks are on page 4 of a claim, and they're not required on standard adjustments. We do strongly recommend that you put something on page 4 so that you or a coworker remember why the claim was adjusted. Remarks are required, however, if you're using a D9 claim change reason code. So if you're using a D9, you're going to have to put something in remarks. We do have a very good article on our website, talks more about this. It gives specific instructions on what's required in each instance. We call them verbatim remarks. Towards the end of the slide deck, we do have a resource slide that'll have a link right to that article. You can also just go to our website, put D9 in the search field, and it will come right to you. Before we move on to cancels, I want to remind you that not all processed claims can be adjusted. There's information in the DDE manual, and we also have an article on our website about those different circumstances. There's also a link to that on your resource slide. Some highlights are if a claim or a line on a claim was medically reviewed, you'll have to submit an appeal. You'll actually get an error if you're trying to adjust a claim that was medically reviewed. If the claim was rejected and it did not post to the patient's master record on common working file, there wouldn't be a need to do an adjustment. You could just send a new claim. How do you know? That tape to tape field that we looked at earlier. That tape to tape field can be seen on the line item detail of your claim, page 2, which is map 171D. And we didn't talk about it in this course yet, but every screen within DDE has a name, a map number. So this is claim page 4. The name is 1714. The detail screen is 171D. So if we go back to that for just a second, that screen, and right here, that tape to tape area, TPE to TPE. We do have a process called TPE, Targeted Probe and Educate, totally separate from this field here. Apparently we didn't have room for 2 A's to make it tape to tape, but this is the field I'm talking about. If there's an X in that field, it means the claim did not post a common working file and you just send a new bill rather than do an adjustment. Using the claims cancel option, you can completely void a previously paid claim. Now, a claim can't be canceled unless it's been finalized and it's posted to your remittance advice. It has to be in a status location of PB9997 or PO9998. That's that offline status that we discussed, in which case we're going to have to retrieve that claim from the archive first and then cancel it. Never cancel a claim in PB9996. That's the payment floor. We looked at that when we were doing that status location exercise. That claim's finalized, but you haven't gotten payment for it yet. So if you try to cancel it, the system may let you do it, but you run the risk of giving back money you haven't gotten yet, or the payment being taken back twice, which can be fixed, but it's a process. We don't want that to happen. The steps for creating a cancel are shown here. A couple differences, though, are that we go into a different part of the claims correction menu. We use different options, and there's one less step because an adjustment reason code isn't required. So here are the cancel options highlighted. You'll choose the one that pertains to your claim, add it down at the bottom, and press enter. Same procedure, search for the claim you need to void, select it, and press enter. And then when you do that, when that claim displays, you'll notice that the type of bill defaults to end in an 8. You'll always need to choose your D code, your condition code, but the only options for cancels are D5 and D6. And I would always add remarks when canceling a claim. Any payment your facility received for this claim is being returned. In 6 weeks or 6 months, will you remember why? How about those of you that might be stuck trying to figure out what a previous biller was doing after they've left without warning? Remarks are always a good idea when doing a cancel. Now, I'd like to share some resources with you so you can learn even more about DDE. And just a little reminder here, we're almost to the top of the hour. This webinar was scheduled for 1 hour and 15 minutes. So we're going to continue on here. Just wanted to state that in case you missed it, because typically we do go 60 minutes. So first, the DDE manual. I've mentioned this multiple times. There are a lot of good tips and reminders in there for correcting and adjusting claims. Second item on this list here, another article on our website. That's more of a getting started with DDE, but it's still good information. The D9 mission code articles, the one I mentioned when we were talking about adjustments. And then this last link here takes you to that article to help you determine if you should be adjusting a claim or sending a new bill. If you are watching the video, look down in the description of the video. I have all the links listed there for all of these resources. So that brings us to the question and answer portion of our webinar. During registration, I asked, what one question are you hoping to have answered during this webinar? And we got a lot of replies, and that's a great thing. So I'm going to go down the list here in no certain order. I've grouped together a couple that were similar. First one, Becky asked, when do we correct a claim versus sending a new claim? And Krista had a similar question. Different situations that require adjusting or rebilling previously processed claims. And we've talked about this. If the claim is still pending in RTP status, you should correct it according to the reason code narrative to determine what it needs so that it can continue processing. Now, if you get stuck or you feel the reason code is not editing correctly, contact our customer service area so that it can be researched and possibly reported as a system issue. Sending a new claim with the same information isn't going to get you anywhere. It's actually going to probably muddy the waters for you. Adjusting or rebilling pertains to finalized claims. The system will not allow adjustments to claims with a status of T because the claim hasn't finished processing. It's not finalized. Claims with a status are denied and they have to be appealed. You can make adjustments to claims with status P or R, paid or rejected, with exceptions. If the entire claim was rejected and has that X in the tape to tape field that we just looked at, you should submit a new claim for processing. The X means it did not post to the patient's master record, so you could just rebill. That article on our website can provide additional clarification. We also received a couple items or questions related to changing lines of charges. Janet asked, what's the most efficient way to correct line items? And Loria said, can I correct charge amounts in corrections? Great questions so far. So you'd think that you could just key over the line that you want to change, but DDE is a different animal. It's a bit more finicky than that. To delete a revenue code line, type 4 zeros over the revenue code to be deleted, or type D in the first position of the revenue code. Then press your home key. That's going to position your cursor in the page number field and then press enter. Be sure to adjust your total charge line to reflect any deletions. The system isn't automatically going to update that total for you. Now, to insert or add a line of revenue, type the appropriate information below or after your 0001 total line. Once you've typed all the information across that line, again, press your home key and then press enter. DDE then will resort the revenue code lines. Again, then you're going to want to adjust your total charges on that 0001 total line. These instructions are outlined in the DDE manual. I probably should have said that before I started talking. Hopefully you weren't manically trying to write all that information down. You can find it in the DDE manual. I mentioned this earlier. I believe it's page 140. We also got a couple questions regarding duplicates. Whitney said more information on duplicate claims and fixing them. And Darlene stated how to do corrections without duplicates. If you're experiencing duplicate rejections or edits when attempting corrections, and you verified that it's not a duplicate claim or it's not a duplicate service, this might be a question that's more suitable for customer service so that they can bring that claim up and look at it with you and see what your next steps need to be. Maybe it's a claim from another provider that's in the way. So they can look and see what that issue might be. Let's see, what other questions did we get? Renee said, I don't understand the reason code when the OCC and MSP codes don't match. I'm assuming you mean occurrence codes by saying OCC. Without knowing the specific type of insurance or the reason code that's involved, I'm afraid I can't really answer that. I do suggest checking the reason/remark lookup tool on our website, putting in the reason code, seeing if it can give you some clue on how to correct that. If that doesn't help, have customer service look at it with you. Carrie asked, can you change an ICN number on a corrected claim? Now, if you're not aware, ICN stands for internal control number. And I'm not sure whether you're trying to adjust a paid claim or correct a claim that's been returned to provider. But no, you cannot manually type or change an existing ICN or DCN, which stands for document control number, on a replacement or corrected claim within DDE. When you process an adjustment, the system automatically ties the adjustment to the original paid claim. The system generates a brand new unique ICN or DCN for the corrected version once it's successfully processed and finalized. Tracy wants to know how to maneuver easily on DDE screens. We did a separate session, a separate webinar dedicated to navigation in DDE, and you can find it on our YouTube channel in the direct data entry playlist, or depending on when you listen to this webinar, you can see if it's still on our encore and short videos page of our website. Beth asked, how do I fix error on days not matching cost report days? Again, without knowing the reason code or being able to see the claim, I'm not able to help much here. Customer service is the best source for these claim-specific situations that you have. Tracy, a different Tracy, asked how to cancel rejected claims. I'm not sure how often it would be necessary to cancel a claim that you didn't get paid for, but there might be situations that I'm not thinking of. And if so, then you would follow the process we went over during that presentation to do that. Donna asked, can you suppress a type of bill 118 that is in RTP? So again, a type of bill that ends in an 8 is a cancel. If it's in RTP status, that means there's an issue with it. So technically, yes, you can suppress it, but I'm not going to encourage that. I would suggest trying to figure out why the cancel is in RTP status, especially since it's an inpatient claim that you specifically mentioned. Asking for the cancel has begun the process of returning your payment to Medicare. And so I'm just afraid that that inpatient stay is going to be in limbo, get stuck, or you run the risk of not being able to rebill it. So use caution, because if you suppress a claim, you can't undo that. Suppressing a claim should be your last resort. So again, give customer service a call if you need help here. Tracy, lots of Tracy's today. This time the name has an E in it. 32200, billing vaccines with Z23 diagnosis rejections. The narrative for reason code 32200 indicates that the claim needs a condition code A6, and then it refers us to Chapter 18 of the Medicare Claims Processing Manual, so take a look at that. And I got the narrative or the description of that reason code by going to the reason/remark lookup tool. On our website, in the top navigation bar, if you use the tools drop down and you go to all tools, you'll find that reason remark lookup tool. Really handy, especially for those of us like me who can't get into DDE because I'm not a provider. You can see what that reason code is saying and maybe see what your claim needs. Dana stated DDE Z codes and changing NPI. Okay, as far as Z codes, I'm not sure if you're referring to ICD-10 Z codes or molecular diagnostic services, but if it is what we call MolDX, you're going to enter the 5-character alphanumeric Z code next to the corresponding line item for the molecular pathology service on map or page number 171E, which is a secondary page for page 2. When on the main charges page, which is page 2 of your claim, you're going to hit F11 once. And so I put an example in here. This is claim page 2, and we hit F11 and we get this screen here. So some tips for you here. Enter only the Z code itself. No extra characters, no spaces, no descriptive test names on that line. That's going to help avoid your claims being RTP'd. Now, this page here is the same page that you would add line level NPIs, because the second part of Dana's question was about changing NPIs. You can't directly change the billing provider's NPI on a pending claim or by adjusting a finalized claim. If a claim was submitted with a completely wrong billing provider's NPI, if the claim's in RTP, you're just going to have to, if it's already processed, you'll have to cancel the original claim first using a D5 indicating an incorrect NPI, and then a new claim could be submitted under the correct NPI. On the flip side, you are able to change the line level rendering or ordering NPI details when correcting or adjusting a claim, and you would do that on this page in this area. Caitlin asked, what are the most common denials? We have a past webinar series looking at quarterly errors for hospital claims, inpatient and outpatient, skilled nursing facilities, and rural health clinic and federally qualified health center claims. You can find the recordings of those on our YouTube channel. Our final pre-submitted entry stated value code clarification. And I'm sorry, Sarah, but I'm not what your question is. If it's related to DDE, I invite you to send it in. I'll give you instructions for that in just a little while, or contact customer service for assistance there. Now we're running out of time, and I do see that we have had some questions added to the chat. So if you submitted a question in the chat, I'll have Tom send those to me. I will send an answer out to everyone in attendance today. But we do need to move on for the sake of time. I want to be respectful of your time here. A couple items here on overpayments. WPS does receive many overpayment notifications and refund requests from providers. And we know that you want to repay Medicare in a timely manner. You want to do what's right. However, if you use an incorrect or an outdated form, that can hold things up. Missing information or sending a check without an explanation as to what it's for are other reasons that can cause a delay. To avoid unnecessary holdups, Consider using the refunds or overpayment claim adjustment features in SNAP. Again, SNAP is our provider portal. This allows fast and efficient processing of your overpayments and refunds to Medicare. There are times when you're not able to use the online portal features. Instead, you have to send a paper check and a paper request. And if so, we recommend including the correct form available on our website. I'll have Tom place a link to an article on our website that's going to help you determine which action or which form to use. This slide is a provider alert announcing a change to mail delivery for Part A appeals submitted through SNAP. Starting June 1st, all providers with an active SNAP account who submit their Part A appeal requests through the portal are no longer going to receive decision letters through the U.S. mail. All appeal letters will be viewed and downloaded directly in our portal. Providers will now receive an email notification regarding a decision on their appeal, and then you'll be able to immediately access that appeal correspondence in the portal. The next National AB-MAC Ambulance Supplier and Provider Coalition webinar is coming up next month. It's open for registration, and we're including this slide as kind of an advertisement for it. It's going to be held virtually on September 16th. You can see the times listed there. All MACs across the nation are going to present information on current active medical review, additional documentation requests, and the comprehensive error rate testing or CERT program and some findings. There's also going to be a question and answer session. So if you want to learn more about this coalition, you can visit our AB-MAC Ambulance Provider and Supplier Coalition webpage. And even if it doesn't pertain to you, we're hoping you'll help us share awareness of it so that we can get this information out to everyone. Another exciting event to add to your calendar and make plans for is the National Provider Enrollment Conference. We just got word of this, so we want to let everybody know. It's going to be held November 18th and 19th in Orlando, Florida. And this is your opportunity to meet with provider enrollment experts from CMS, from the MACs, and the Durable Medical Equipment National Provider Enrollment Contractors. Registration will open in just a couple weeks, so mid-September, and you can visit the 2026 CMS National Provider Enrollment Conference webpage for more information. So if you want to start planning to attend there, I'll have Tom drop a link to that page in the chat. Please take a few minutes to complete a survey for us about this course. Tell us what you liked, what we could do better, give us topics for future education. You do have a few options depending on your preference. You can use the link in the chat, or when you exit the webinar, you'll be asked to go to an external site for the survey. That message is going to look like the top picture here on the right side of your slide. It'll have the triangle and the continue button. If you're listening to this course as an encore, box is going to appear at the end that links you to the survey. It's going to look like the other example here at the bottom of this slide. You can also scroll down in the description for this video if you're watching the encore to find the link to the survey. Those surveys are so important to us because they give us insight into not only how we're doing, but the types of education that you want and need. Later today, you're going to receive an email from me to thank you for attending this event. This email contains a copy of the slide deck and your certificate of achievement. It has your name and your contact hours, so if you need to turn it in for credit towards continuing education units, you'll have it. If you think of a question later, you have 1 week from today to submit a follow-up question. Send them to our education mailbox, put today's date and something about direct data entry in the subject line. That way they'll come directly to me. Also, the questions that have been placed in the chat that we didn't have time for, I will be responding to those as well and sending them to everyone in attendance of the live event. On behalf of myself, Tom, Shakura, everyone in provider outreach and education, I want to thank you for your participation today. We hope to have you join us for future education, and we look forward to that survey feedback. Thanks for attending, everyone. You may now disconnect.